We'll call our workshop to order. This is a health and wellness service team. It's on food security assessment findings. Two quick announcements before I turn it over to the folks. One is I broke my own rule. I've got a noon lunch I had to schedule with on the east side here. We've been trying to schedule it for a month. It's just been canceled and I did it. So I'm gonna have to leave about 20 to 12 if we're not done. You know, the chair or somebody will have to wrap up, but I wanted to be respectful of that. I broke my own rule. And two, when we all chair these workshops, right? And, staff tends to reach out and say, do you have questions? You want to walk through the slide deck? Any talking points you might need, to kind of kick it off. And typically I'm pretty good, I'm good. But I got an email from Carissa Dillon earlier in the week, and she just, said, here's some talking points if you want them, right? I'm going to read them. These are not my words. These are Carissa's words. And I want to read them and give you credit because it really instills in me, and I think it will instill in you, the confidence that we can have that someone truly brings heart and mind to this work, this critical work we've been doing. So these are Carissa's words. As you all know, it's Thanksgiving this week, where many family and friends gather together for a shared meal. Not everyone has that opportunity to do this. Inflation, economic downturn, along with climate change, has affected food production and food insecurity, and COVID provided us additional awareness of just how difficult it can be to be food insecure. Our Ramsey County community is disproportionately food insecure. This includes people within our racial and ethnic communities and vulnerable youth and older adults. As you know, work that took place during the first year of the COVID pandemic with the leadership of many of my colleagues here, Commissioner Ortega in particular, and Ramsey County leaders has moved us down a path that is more aligned and is creating strategic direction for the county and is coordinating resources, funding, and aligning with other strategic priorities to promote food security. I'm going to hand it over to County Manager Hadeen and then Food Security Coordinator Carissa Dillon to move forward. Aren't those wonderful words? And don't they just really say exactly what, in the very beginning when we were starting these, I can't even remember what we called them, when we brought community together and we had 4 or 5 areas and food security popped up and Commissioner Ortega was the lead. And Carissa got involved early, but to watch this blossom and have the impact it's had in community, but then, as you point out, having those strategic conversations about how to continue this work, because even though the pandemic really highlighted the need was always there. And we always had people silently kind of moving forward and struggling with this. So Kathy, it's all yours. Thank you.
Thank you, and good morning, Chair McDonough, Commissioners, and County Manager O'Connor. Happy to be here this morning on this Thanksgiving week. This is that time of year when we are reminded to pay gratitude for many things, including the food that many people and communities and cultures share with one another and turn to feed themselves and their families and their overall well-being. We're also reminded, as Chair McDonough stated, that not everyone is food secure and that food should be a right for everyone and not a privilege. A lot of good work and partnership and community has taken place over this last 2+ years in this area to help Ramsey County set out on a course that strategizes and coordinates this work across the county system and lays a foundation for building resources and capacity with community to address the dire food needs of our community. If any of you have been listening to NPR over the last couple of days, there's been news stories about how important this is right now and how many children, young people, older people are really not getting the food that they need. You typically cannot see hunger the same way that you see other social and political determinants of health in our community. People who are food insecure are not typically in plain sight, which can make it hard to conceptualize and hard to address. The workshop today will help to provide a framework for how Ramsey County will continue to address food security within our community. I want to thank our Ramsey County Food Security Coordinator, Carissa Dillon, for her leadership and hand it over to her now to introduce others and to move through this important workshop.
Do I have to push the button?
You're on.
Oh.
If the red's on, you're good.
Oh, good. Thank you. Thank you, Chair McDonough and Commissioners and Deputy County Manager Hadeen for the introduction. I have with me Malik Mitchell with Imagine Deliver, and he'll be talking a little bit in the future, and then Sarah Otten from Research and Evaluation within the Health and Wellness Service team. So food insecurity is when there isn't enough food for that every person in a household can live a healthy, active lifestyle. People experiencing food insecurity are forced to make tough choices that can impact their long and short-term health. And they may rely on cheap, unhealthy food, skip meals, or may not follow specialized diets according to their health issues like diabetes or cardiovascular disease. And within Maslow's hierarchy of needs, food is one of the most basic needs to survive and thrive. And like Kathy mentioned, there's a lot of shame associated with food insecurity, making it hard to measure. Yet it can have long-term impacts on mental and physical health. To give some background, back in March of 2020, when the pandemic hit, a food and basic needs branch was set up in part of our response. And during the pandemic, Ramsey County dedicated $10 million of CARES funding to respond to immediate food security and basic needs for those most affected by COVID. And this was all rooted in community input of our direction. And then in 2021, a food security coordinator position was created, and this position was tasked to align efforts throughout the county, as well as help determine the role of the county in addressing food insecurity. As far as I know, this is a unique position in the state. I don't know of any other positions like this, so it is very innovative and forward-facing. A couple of the recent and current efforts to address food insecurity, where I'm trying to align these efforts, are with the Advancing a Holistic Approach to Strengthen Families. It mentions access to healthy foods as a priority area, and then the upward mobility, or the Urban Institute's upward mobility, also names food security as an indicator to help move people upward out of poverty. Again, as a reminder, our 2040 comp plan actually mentions eliminating food insecurity by 2040 with our community partners. And then there's some other bullet points here below that talk about other recent and current efforts that this work is building on. So this workshop is focused on the assessment. As you can see, the assessment started late last year with informational interviews and some data points identified, and then this year has continued to prioritize and finalize the data. And then moving forward, we hope to communicate the findings and form action teams to move this work forward. And many people have helped with this assessment, providing support, direction, and recommendations, and thank you for all of our community partners that might be listening, as well as other internal staff. You'll see that this work is rooted in a whole team, and we're trying to leverage existing energy and passion to move this work forward. Overall, the assessment has compiled quantitative and qualitative data, and then we identified community-designated priorities. And then we want to understand what Ramsey County's role is in addressing food security. And you will hear from our guests, Sarah and Malik, to talk further in this next section on this data. And I'll turn it over to Sarah.
Good morning, Chair McDonough, Commissioners, County Manager. According to the U.S. Bureau of Labor Statistics, in 2020, low-income families spent 11% of their household budget on groceries, whereas high-income households spend about 7% of their household budget on groceries. Low-income families also spend more of their household budget on basic needs like rent, utilities, and health insurance, which makes it more difficult for families to afford food when other costs go up, which in turn widens existing inequalities. In recognition of this challenge, we've been tracking food insecurity trends through primary data from our county's financial assistance services systems, as well as secondary data sources like the U.S. Census, the state of Minnesota, and the University of Minnesota's food security data. The information we've gathered is shared publicly on our Food Insecurity Open Data Portal site, which we've provided the link for here. And now I will walk through some of the data that we've found, as well as other measures we have examined. I want to note that these are proxy measures of hunger, so they give us an indication of how food security has trended over the past few years, but it may not fully reflect the scope of the issue. The first measure I'll share is Ramsey County's overall food insecurity rate, which is an estimate taken from Feeding America's Map the Meal Gap dataset. This graphic shows how our food insecurity rate compares to the state average. As you see, in 2021, Ramsey County's food insecurity rate was estimated to be 10.9%, as shown in the teal line second from the bottom. This translates into an estimated 60,000 food insecure residents in Ramsey County. And this rate is higher than the state average of 8.6, which is shown in the bottom green line. In addition, more children are food insecure in Ramsey County than statewide. As shown in the top gray line, 20% of Ramsey County's children were estimated to be food insecure in 2020, which equals more than 22,000 hungry children in our county. And while this rate is estimated to have decreased slightly since then, we're still above the current state average of 12.5, which is shown in the dark blue line. The next slide looks at children's participation at SNAP and WIC. SNAP is the federal food stamp program, and children under 18 are the largest beneficiary group, making up 38% of all recipients in Ramsey County, which translates to 31,000 children under 18 receiving SNAP assistance in 2021. We do see SNAP participation is dropping off significantly for youth ages 18 to 24, who make up only 8% of SNAP beneficiaries, which suggests that youth need support that they are not accessing. WIC provides food and other support for pregnant people and children under 5. As shown in this pie chart, racially and ethnically diverse children are more likely to participate in WIC than are their white counterparts. Asian children are the largest beneficiaries of WIC, shown in the navy with 39% of the total WIC recipients. Black or African American children make up 29% of WIC recipients, as shown in green. Children of Latinx ethnicity who identified as white make up 11% of WIC recipients, and in addition, Latinx children identified as non-white make up additional 5.43, for a total of about 16% Latinx children. And white children, shown in the light teal, make up 9%, despite being the largest proportion of our overall population. As we continue to analyze who is food secure by race and ethnicity, we see this trend overall that white and Latinx residents are using government food assistance programs at lower rates than their population size, and at lower rates than their Black or Asian counterparts, who generally participate at rates more reflective of their overall population. This next slide shows a proxy measure called SNAP Participation Access Index, or SNAP-PI. The SNAP-PI measure divides the average number of people who are eligible for SNAP per month by the number of people who are living at or below the federal poverty guideline. So in Minnesota, we used 165% of poverty as our SNAP eligibility until this past December, when it was raised to 200%. So in reading a SNAP-PI index, a score of 100% or more would estimate that all the residents whose income levels are eligible for SNAP are receiving the benefit. Again, this is a proxy measure that doesn't take into account all of the eligibility factors, but it gives a general idea of the extent to which people are participating in food stamps. And so you see, Ramsey County's SNAP-PI rating for 2021 was about 51%. So that means about half of our residents whose incomes would qualify them for SNAP are receiving the benefit. But if you break it down by racial and ethnic identity, you see that 85% of income eligible Black or African American residents are accessing SNAP, 60% of American Indian residents, and 68% of Asian residents. So that's about 2/3 of those populations. But if you look at SNAP-PI rates for white, Latinx, and multiple race residents, they're lower than 50%, which means that fewer than half of these residents are accessing SNAP, and suggests that they may not be participating in SNAP for reasons other than income eligibility, like lack of awareness, social obstacles like shame, and or reluctance or fear of taking government benefits. It is interesting to note that adults 55 and older make up the second largest category of SNAP users, and we'll come back to talking about older adults in a little bit. But continuing to break down the raw SNAP rates by race and ethnicity, we again see further how white, Latinx, and multiple race residents are participating at a lower rate than their overall population. The green bars on this are showing the overall population, and the blue bars are showing SNAP participation. So you can see where things are not exactly lining up. And these rates are not only showing disparities in participation between the various racial and ethnic groups, they're also showing what a large proportion of our Black and Asian residents have incomes that qualify them for SNAP assistance because they are close to or below the federal poverty guideline. So if you break it down by raw numbers, 43% of all of our Black or African American residents, all of the residents in Ramsey County, 43% of our Black residents are on SNAP. And 30% of our Asian residents are using food stamps. Comparatively, 5% of white residents are using food stamps. So while it's good that Black, American Indian, and Asian residents who need SNAP are receiving it, the proportion of these residents who need and qualify for food assistance is very high compared to their overall population, which demonstrates our legacy of inequitable policies and how they've affected our residents. And this is an equity issue that the county continues to address by providing policies and programs to make food more affordable for all residents, especially those living in poverty. Next slide, please. Another aspect of our work over the last year has been to increase our data sharing practices around food security, including working with the state of Minnesota to get Ramsey County specific food shelf usage data. And these rates are for the TFAP funded food shelves specifically. So as you see in the graphic, our food shelf usage rates have risen in the last year. And so by the end of the year, our projections indicate that the total number of individuals served by the TFAP food shelves will increase by 30%. This increase is mostly seen among seniors whose usage has increased by 70% in the past year, and children's usage is projected to increase about 32%. One note about the data coming out of these food shelves. As Deputy County Manager Hadeen mentioned earlier, there was a story that came out of NPR recently that was reporting some additional numbers on food shelves. And the estimates that we saw in the very first slide saying that the numbers are going down, those may need to be revised because it looks like that's not happening as it had been expected. And food shelves are reporting at least 25 to 30% increase in demand, with some numbers saying as high as 45%. So you can see in these two graphics how the food shelves are distributing their food. We project they're going to distribute 8.7 more million pounds of food this year 8.7 million pounds of food, which is 2 million more than 2021. So again, about a 25% increase. But while they're serving more food, the demand is higher. So you can see the numbers of pounds is going up, but the pounds per person is going down. And our projections indicate that the food shelves will serve more than 100,000 more people this year than last year, and those are not unique individuals. So each time somebody comes, they would be counted. But as the amount of food increased, the amount of people are also increasing, so the total pounds served per person is projected to fall below 20 pounds per person per year, which is about 3 pounds less than last year. So it's about a 12.5 decrease in the amount of food each person is receiving per visit. So looking at all of these numbers, we wanted to hear from the voices of those in our community, especially those experiencing food insecurity directly. So we contracted Imagine Deliver to conduct community engagement work, and I will now turn it over to Malik to talk about what we heard.
Great, thank you. Again, my name is Malik, and I am with Imagine Deliver. I am the Insights and Innovation Strategist, which means that I lead a lot of the community engagement and the report writing for Imagine Deliver. So when we started working with Ramsey County, this particular topic was close to my heart. My background is in public health with a special focus on health equity, so I was really excited to be able to hear from community on what they thought about this topic. One of the first things that we did was we wanted to get a snapshot of the landscape and all of the work that has been done already by Ramsey County. So we had several meetings with Carissa, and that included talking about over 70 interviews that she conducted to gather information and context in the landscape that we're going into, we also met with other key stakeholders to talk about our priorities for our community engagement. So for community engagement, we did 6 pop-ups, and what a pop-up is an event within community so that we can gather information and then talk about all of the wisdom that they have to share with us. A pop-up can look like a bunch of different things. They typically last anywhere from 90 minutes to about 3 hours. And we went to our 6 community partners that we worked with for this particular engagement. How we picked these community partners is we looked at areas in Ramsey County that experienced high levels of food insecurity, and we didn't want to stick to just the city of St. Paul, so we made sure that we got out into the suburbs and had conversations with folks. We partnered with food shelves, food pantries, other food programs, as well as St. Paul Public Library, so that we can get a little bit of information from family that we're going to a family event there, because we know that families are disproportionately impacted by food insecurity. We spoke to over 300 community members across these 6 locations, and we distributed over $4,000, nearly $5,000 in incentives, and those were thank you gifts for their wisdom that they shared with us during community engagement. When we do reports like this, we like to break down and really understand the types of folks that we're talking to for this particular engagement. So we took a bunch of demographic information. It was all optional, whether or not they gave that information to us, but the majority of people did. So out of 306, we had 290 folks that offered some kind of demographic information. And we saw that the majority of folks that did talk to us were BIPOC individuals at 68% of the total demographic population that we collected from this particular engagement. So when we are cultivating all of our information and we put that into an insights report, that is a report that tells you about the work that we did, and it breaks it down into a bunch of different categories, which we call themes. You'll see 3 themes across the information that we're going to talk about today, the first of which is food choice and autonomy. So we talked to community members, we gathered our priorities, and we had conversations with them and engaged them in a few different questions, and this is the information that we got. Our first insight within the theme of food choice and autonomy was gardens on every block. And what that really means is that community members are really interested in having localized food and having more control over where their food comes from in their communities. So that was really important to community members. And as a part of qualitative data analysis, one of the things that we love to do is get information from people in their own words. So throughout the next several minutes I'll be talking to you, I'll be sharing some quotations from the report that we pulled. So again, community members are really interested in having that local experience when they're choosing the foods that they'd like to eat. And one community member, quote, "More farmers markets, a way of extending their seasons and having those in enclosed spaces." So really getting access to those foods that are fresh and locally sourced through an extended season was something that folks were really interested in. The next insight that we talked to folks about in the theme of food choice and autonomy was that community knows what's best for them. So community really knows what healthy food is. Whether or not they have the access to that is a different topic for them entirely. So when we talked to community members, they were very interested and very knowledgeable about what types of food that they wanted. They wanted food that was less processed. They wanted access to organic produce. They wanted access to fresh meats if that was part of their diet. They also wanted access to foods that fit their cultural and dietary needs. So they are aware of that. And for some folks, a lot of that is out of their reach. It could be for a lot of different factors, but we found that one factor is definitely food affordability, which we'll talk about shortly. But one community member shared with us, quote, "Daily, affordable, healthy, and sustainably sourced meals for families plus snacks for kids. Community gardens, food processing resources, and educational resources for everyone" was something that they were interested in when we talked to community members. So the next theme, second of 3 themes that we talked about, was really focused on food affordability and supplemental assistance. So the first insight within this theme bucket was really talking about how there are several compounding factors that make it difficult for people to be able to afford the food that they want to choose for themselves and their families. So we talked to community members, and one of the overwhelming things that they talked about is that high prices for fresh produce, prices for food overall, and a need for more discounted food programs were among one of the issues that they commented on most frequently. when I was going through the data and pulling that qualitative information, there were a few folks who talked about how they fill gaps in some of the food access that they experience, and some people were really honest with us and very candid, and they said that I steal it. I steal the food that I need for myself and my family. So that was really good information to have, and really nice to know that folks felt like they can be that honest with us when it comes to meeting their food needs. The next insight in this bucket of food affordability and supplemental assistance really focuses on some of the assistance that Sarah was talking about earlier as it pertains to SNAP and WIC. So we knew that community members perceived public assistance program requirements and the administration around it to be particularly confusing and unaccommodating for them. When it comes to families with incomes just above the qualification threshold, and those who have unstable living conditions, such as those who are unhoused, and those with children who have aged out of programs such as WIC. So when talking to community members, some of the things that they had to say was, quote, "We have no little kids at home, and we make too much to qualify for benefits, but not by much. There's a middle group of people who don't qualify, but can use a little bit of assistance." So that was something that came out quite a bit from community. And then the last big theme that we talked about was filling gaps in food availability. So this one talks a lot about how formal programs and services really step in where government resources aren't enough for people. So some of the things that came up a lot during this one was something that was actually really interesting to me. One of the locations that we went to was in North St. Paul as an emergency food shelf. And when we asked folks how they filled gaps in availability for food for themselves and their family, how they experience food insecurity, we had folks look at us and say, I don't need those resources. Like, I don't consider myself to be food insecure, which was a little jarring for me because we were outside of an emergency food shelf, right? People were lining up early to be able to get food from the food shelf. And in conversations with community members, they were talking about how they access their food. So they would list things like Aldi, Walmart, Cub Foods sometimes, food shelf, and then they go to their friends and family. So I really had to change my lens, and a lot of these community members were saying, I don't consider myself to be food insecure because I have access to food shelves and food programs across the county, rather than the frame of thought that I was going into the conversation with is folks are food insecure, which is why they're accessing these resources. So that was a really interesting shift of frame for me when I was working with community members. So I think that really speaks to how foundational a lot of these programs are for these community members, that they don't consider themselves to be insecure because they have access to these food programs. So another quote from folks, we've used St. Paul Public School lunches and EBT services. We also take on more work. We are also lucky to have a small garden and family nearby to be able to help and supplement the food that they need. And then the last insight that we pulled from this larger bucket of how people fill their food gaps and food availability is that participants have used their networks to circumvent some of the issues they consider and that they encounter with formal resources. Some of those considerations or some of those issues that they run into would be lack of transportation to get an adequate amount of food for themselves and their family. So another quote that was shared by community members is, when I don't have enough food, I go to Taste of Today or Gustavus Adolphus Church. I ask my mom or my sisters if they have extra food. Another community member, quote, when I don't have enough food, I ask my family to borrow food stamps, end quote. So we're seeing people who are really heavily utilizing their community networks and their community's resources to fill those gaps in availability, as well as using food shelves and other food programs across the county when they don't have enough resources, whether that be through the state or through the federal government. I'll pass it back to Chris.
Thank you, Malik. Definitely, I've been in the food world for some time, and, some of the quotes that you said, that you heard from community, made me just think about, like, people are being honest about stealing food and who's in our justice system and who's getting targeted at grocery stores. So it becomes a bigger issue than just getting food for your family. And then also just the whole idea of not saying I'm not food insecure because I'm going to these emergency food systems and how reliant people are on these systems. But so thank you. It's great to hear from people, because a lot of times people won't talk about this because it's so full of shame and it's very hidden. But I do want to go back and reiterate a little bit about what Sarah spoke about of who our priority populations are. So youth and elders, we know, just because of the data, as well as our racially and ethnically diverse communities, and they're bearing the disproportionate burden of food insecurity, and thankfully are accessing county benefits like SNAP and WIC, thankfully. However, these populations will still be considered and the focus in the food security action items mentioned on this slide. So I'll go over each bubble, and they're broken down to priorities of immediate actions, medium-term actions, and foundational actions. So the immediate steps to address food insecurity in Ramsey County, as determined by priority or by community, is to enhance the food safety net system to increase access to public benefits. So SNAP and WIC are part of this, but if food insecurity is a financial issue, getting access to housing, health insurance, and other benefits would also alleviate some pressure in the family budget. For the first bubble, enhancing the food safety net system, it's a priority because people are relying on these services, such as food shelves, mass distribution, and other programming, and demand has increased since this time last year. These services are vital to address food insecurity, and enhancing their operations will be one of our main priorities. To highlight a few topics prioritized by community in this area is food to people, which is focused on transportation, needing to be reflective of the food safety net system, like delivery options, even talking to Metro Transit and busing, as well as our Public Works Department, to allow flexibility and design to support those who may not have access to a vehicle. People also want less complicated documentation to receive food, since that tends to be a barrier to going to food shelves. And we know public charge has created a lot of fear. We still see that. And so people might not seek services at a food shelf if people are asking too many questions. And then also we would like to really focus on making sure the food shelves and emergency food systems have more culturally appropriate, healthy options available for people to make choices. And I'm not saying that food shelves aren't doing these things, but this is what communities said, and they might be based on experience or perception or a history or what their neighbors said. So it's something we want to enhance and continue to build. To highlight the gray box on the right, a few initiatives have happened more recently in the last year since the CARES funding has expired for the food work. Community and Economic Development Department, they allocated over $600,000 through their Community Development Block Grant, coronavirus funding, to help support 5 suburban food shelves. However, it's great, but however, a majority of this funding went to one opening a new location in Little Canada, which is great. And then Workforce Solutions also helped support staff at food shelves through the Dislocated Worker Program. And then more recently, an RFP closed yesterday to support the emergency food safety net system through our strategic priority funding. A total request of $1.7 million was asked for in all the proposals, and right now we have about $220,000 of primarily strategic priority funding to dedicate to this priority. The next bubble is increasing access to public benefits is another thing we've heard to combat food insecurity. And so, as mentioned by Malik, applying for benefits needs to be more dynamic and flexible per community, and community has also requested more co-applications for county benefits, so community doesn't have to navigate our complex county benefit system. I'll talk about that in a little bit more slides, a few more slides, but for example, the Minnesota Department of Health administers WIC, and the Department of Human Services administers SNAP, and they don't data share. So it's hard, and it comes down to the county. So our WIC workers can't refer to SNAP, SNAP can't refer to WIC, and we can't share data. And so this has to change if we want to be kind of that one-door Ramsey. We want somebody to come in one area and get referred and enrolled in all the benefits they can. Because like I said, if they get housing support, it's going to help with food security. If they get all the other programs too. And of course, we want to protect privacy. So it's not like share everything, but we would like to to navigate a path. There is a small work group with the strategic priority of advancing a holistic approach to strengthen families' goal. I'm working alongside December Brakefield, the early childhood planner, to lead a group to assess and problem solve in the hopes to streamline the benefit applications and referral process. And also in trying to expand and increase access to public benefits, the new MN benefits platform opened up. So that has helped, allowed more ease of applications. And then again, like Sarah mentioned, the SNAP eligibility increased to 200% federal poverty guidelines, which is really great. And then finally, on this priority area, expanding benefit use and redemption to include where SNAP and WIC can be used is happening thanks to our SHIP, the Statewide Health Improvement Partnership partners. They're working to make SNAP and WIC more accessible at farmers markets, so people can use their benefits there and their farmers market bucks. And then also SHIP is helping connect healthcare clinics to our WIC and other health-related referrals. So for medium-term actions, you'll see here urban agriculture, as well as combating inflation and other budgetary concerns through subsidized programming. So urban ag won't solve food insecurity alone. We know this. However, we found in community, as mentioned by Malik, that gardening and urban agriculture provides food sovereignty and autonomy, as well as helps community be more resilient in factors of the food system stressors. Additionally, growing culturally specific herbs and vegetables can enhance food taste, acceptability, and also bring community together. The areas that community focused on include expanding urban planning in current and future developments, and there is a passionate group of nonprofits and community members who would like an easier process to access land. More recently, we held a contract through the SHIP grant with TCALT, the Twin Cities Agricultural Land Trust, and they are completing a municipal policy scan related to land access and urban agriculture support, and we hope to leverage this work moving forward with our action teams. And then as for the subsidized programs, the last bubble on the bottom, expanding food affordability and availability, such as farmers market bucks and Fair for All, these would be helpful to combat inflation and promote affordability and healthy foods. And then we'd like to put some money into, or efforts into, and energy into their expansion. There is a small effort happening within SHIP with Brightside, which is a small organization that's delivering affordable produce to corner markets, and they're subsidizing the cost for people. So some foundational action items that we really want to work on based on what community said. Listed on this slide are topics that community members want more information about. So we're trying to streamline and coordinate all of our communications in general, and also leverage existing energy like extension. So I'm meeting with them next week to talk about how can we work together to promote some of the things that community has called for. And then, of course, we want to focus on different languages and certain priority demographics as kind of target areas to really do some education and information resource sharing. Also, we heard from community, we need to use trusted messengers, even the service center navigators, and also leverage social media to promote tools and resources by neighborhood through formal and informal networks and connections. The last bubble I'll go over is advocacy. So in 2021 was the first year that hunger and food insecurity was named in our legislative priorities. Thank you. It's great. And we continue to build on this momentum with government relations. You know, a question that comes up a lot is who should be responsible in addressing hunger? It is hard to answer, and it seems that community thinks it should come from federal, state, and local policy and funding support. It's a group team effort. Again, to highlight on this slide, some of the things that we would like to continue to get support on is the co-enrollment of county benefits, like I said about the MDH and DHS split, but that doesn't even take into account free and reduced lunch through the Minnesota Department of Education. That's a whole different bureaucratic system, and there's not a lot of information sharing there. So that's one thing that I think if we could put pressure to make some changes at the state level would help us at the county level. So of course, we're gonna help push free universal school meals. Also, I want to highlight that the Farm Bill is coming, which will influence SNAP as well as the farmers and food supply. And then also, you'll see here about the increasing the WIC guidelines. WIC ends at age 5. Most kids start kindergarten at age 6, and they might get on free and reduced lunch at that point, so there is that gap year. So we'd like to see WIC go up to age 6 until they're on free and reduced lunch. And then also, just generally trying to think about implementing food security work outside of food. It's not just a food issue, it's connected to so many other things. So thinking of our climate, health, urban planning, and transportation, and really having an eye on food access and food security when we think of these decisions and kind of broader systems and initiatives. Next slide. All right, so we wanted to show you here that really in this role, in this effort, we're trying to streamline and really align the strategic priority and the Urban Institute's work. Both have mentioned, addressing food insecurity. And then we have the open data portal page that we're trying to link with all this data. Our ultimate goal is to decrease food insecurity in Ramsey County, but also increase the amount of food distributed by food shelves and increase SNAP enrollment. And then, like I said, in the gray box, you'll see in the future, as action teams are formed around those bubbles, we'd like to build additional measures with community to what would be a measure of success. So maybe around urban ag, maybe around policy change, maybe even communications, and try to build it out with community. And then for next steps, like I said, we'll be building out into action teams and collaborations, and we don't want to duplicate or reinvent anything. We really want to find where the effort is and passion and join current momentum. Yes, we want to do things as a county and stay focused on our priorities, but we don't want to start anything over. We'd rather join what's already happening. And then also a priority is to continue to engage with communities. So you'll see that in the next couple of months, I'm going to try to bring this show on the road with the team and really talk about it, because I'm meeting with at the state level with people. I'm hoping to meet with different departments at the state and then also other counties to talk about it. Because this is all Ramsey County data, but we're trying, it's probably the same everywhere. It's not geographically bound. And so we're trying to streamline all the messaging to promote this as a whole area, a whole state, a whole Twin Cities area. You'll also see here that I'm going to be applying for grants and streamlining existing county funding from several different departments to try to make a larger impact to help our community. And then in closing, thank you so much. It's a timely topic this week with the holiday season coming up, and I would love to answer any questions with the team.
I know we've got some questions from the board, but I'm going to start us off with one. There's kind of a theme here, especially focused on the SNAP side of this, but certainly it hits on the WIC piece of, utilizing, we see the gaps in eligible folks that are actually utilizing, especially SNAP. And then you talked about, this effort here, one of the barriers about, the state system being in two different departments and not sharing data. So I got kind of two questions to that, but they're related. So because SNAP is a federal program and money comes through the state to us, where are the biggest barriers as far as the administration to qualify for that? How much control do we have in that? Or is that state or federal saying you have to do this, you have to do this, and you have to do this? Or are we at the local level adding on? And then the other piece of this is you talked about, our WIC clinics over here. But my recollection is, Ramsey Washington Community Action Partnership actually manages Ramsey County SNAP program, which is really even more of an arm's length away from, this integration of trying to, so And every single area we work in, whether it's corrections, human services, public health, almost always is this barrier at the state level about data sharing and being able to leverage that, and we haven't been very successful. But where we can control our decision-making, does it make sense to actually bring SNAP back in and put it in with the WIC clinic? So people are coming through the same door. We got the same workers working together and administrating these two programs that we feel pretty strongly would actually leverage and strengthen the utilization rate. I know you did mention there was a work group to talk about kind of the application process, but I wanted to get a better sense of, is it us at the local level? Is it CAP? Because they're administrating at every level, are that we adding more and more to the administrative side that by the time we actually get someone applying, it becomes burdensome to actually apply?
Thank you, Chair and Commissioners. That is a complex question and statement. So federal administers SNAP, yes, the USDA. It comes to the state through Department of Human Services. The state was able to increase to 200% federal poverty guidelines. That's not a nationwide thing. That was the state of Minnesota doing that. So there is a little bit of wiggle room within the state of how we administer. I'm not a SNAP expert. I'll say that. And there's lots of details in that question. But I think, so what happens as far as I can tell with SNAP is we have county workers signing people up for SNAP. We also have contracts with external vendors like CAP, even Hunger Solutions. I think Second Harvest has some SNAP people as well that are trying to get people enrolled just in general as another point place. And so I don't know what the answer is, if it's co-locating SNAP and WIC in the same building necessarily. Some of the solutions we thought of as a team coming together is really doing kind of even, say, an intake form that assesses for all benefits instead of just MN benefits or, WIC benefits, but something that kind of asks general questions for a lot of different ideas. And it could be through a navigator at a one-stop shop, or it could be an online form. We're not sure what the answer is. We're still trying to problem solve that. And I don't know if I answered all your questions.
And you know what? I mean, maybe there aren't answers right now, but taking some of that back to some of the conversations you're having within the work groups to really kind of, because, sometimes we just make little changes, and in this area, I think we need to make some bigger leaps. I think, your concept of, one intake form, then kind of that. But we've talked about that almost as long as I've been on the board. And every single program has different requirements, right?
Exactly.
And that becomes the problem then. Income over here, assets over here, this don't align, this don't align. So it gets really complicated almost after the first question. And, there's been efforts to try to align the actual qualifications so that, they're the same. Income qualifications are the same in programs, asset, all these types of things, so that we can be there, and the more we can do that, I think, are some of the solutions. So I think I seen Victoria's hand up. We'll just go right around. How's that? I think everybody, and thanks for waiting for them to get through the presentation. They did a nice job. Right?
Thank you. Yeah, this is, for as long as I can remember, SNAP and the food insecurity issues has been just a real big hurdle to try to get through. And so often, because of it being in the Farm Bill, it's different than most of the other things that we are trying to deal with. And I remember being out with Dean Durgan about the funding coming through. And it's always been on the chopping block, which makes no sense whatsoever. It's kind of the basic. You need food. And then and it does seem like they put so many qualifiers on it that it makes it more difficult for people. A lot of people don't even know about it as far as what the opportunities are. And so it's something, yes, that we need to really hopefully get some. And again, I know it goes through the Farm Bill, and so whenever that's reauthorized, then we go through the fight again. But we haven't always won. And not all that long ago, the funding was cut dramatically and then had to go back and try to fix something once people realized what it really meant to families. I do have some questions about the SNAP and how this all fits together, because we've got the school lunches, which I did see that what was it, it wasn't free and reduced lunches, but for folks that were most in need where they hadn't paid, and providing, and basically, I think you called it food shaming of kids. You know, okay, you haven't paid your bill, so you get a cheese sandwich. And making it really obvious to their peers. That was the Attorney General successfully stated that that's not something that you can do, or went through the courts. But it's so basic, but at the same time so complicated that people don't really know what's available to them, and they're afraid to go to get the benefits that they need for their families. So I guess I'm trying to figure out how we reinforce, and I know that there's a lot of work that's been done, and I think the data is so incredibly important because it's going to help us in promoting or supporting legislation, because oftentimes that's what this comes down to, because it comes down to funding. And then the communication side of it is something that we can work on. One of the questions that I was wondering about was, are the rules such that we can't, I mean, are we really bound by all of these requirements and they're all different? Or is it something that we, as a county, have some flexibility on how it's implemented? And could we, again, as a county, reduce some of those barriers?
Thank you.
That's a lot, I know.
Commissioner
If I could, real quick, I know you've got the work group working on that piece specifically, especially what we can control. I know Ryan wanted to make some comments on your earlier pieces to that, and then we can revisit if you have comments on the application process and what we can control of that, right?
Thanks, Mr. Chair, Commissioner Reinhardt. I'll just say on the schools piece. I mean, we talked, it was at the Joint Property Tax Advisory Committee, it was a little over a year ago, as we were worried that the free breakfast and lunch programs that have been funded since COVID were going to come to an end. And county representatives there were declarative on why we think that's an important piece to find a way to continue going forward. And one of the response we got back was the administrative burden to tracking and everything else. And at some level, I hear everybody on that. It doesn't matter. And this is one that seems very clear to me, where truly funding breakfast and lunch for all students disproportionately benefits those in need of food. And it's just not an exorbitant price tag in the context of our public systems. And I would encourage us as a county to think about if this is a legislative priority that we want to pursue. The money does not come to us, but it benefits who we heard from today. And maybe we just need to get a little tighter leaving here with our school districts then to really align around this, because it just seems to make a lot of sense.
Yep. Krista, did you want to add anything to Commissioner Reinhardt's comments?
Yeah, thank you, Commissioner and Chair and other commissioners. So it seems it matters who you ask. As far as I can tell, when I've talked to our legal team, we are able to share data, but it actually sits at the state that makes it harder to share data. Like, I think one department doesn't allow us to share with other departments. And so we're still trying to navigate where the actual barriers and stops are to share that data. Of course, we want to make sure we have compliance and privacy and people actually want their data shared. We don't want to just share people's data left and right unless they're interested and willing. But it's something we're trying to investigate and figure out what really is happening to see if there can be some pressure at the state level to change it so that the county has more freedom. Otherwise, it's us with this work group trying to, find a workaround to help make it smoother and easier for our residents applying so they don't have to navigate our system, which we're just mimicking what the state systems are doing.
Okay.
Oh, and I do think it's also interesting, not just with the schools, because that's where the primary opportunity is, but when school isn't in session.
Yeah.
And some of the nonprofits that are now trying to fill that gap in combination with us.
Good. Kathy, then we'll go to you, Nicole.
Thank you, Chair McDonough and Commissioner Reinhardt. Another piece of this is our human services systems modernization work. As you know, it's cumbersome, and it's a lot of different programs, and so that's a piece of what both September and Carissa are working on with Jennifer Schuster-Yeager over Health and Wellness Admin Division. Jennifer also sits at DHS within their data work groups to try and talk about how cumbersome this is at a county level when you're implementing this work, and how to not necessarily make these workarounds, which is what we have to do until we can figure out a better system, but to change the way in which data is used in these systems so that we can do a better job on our end. We know we have to do the hard work on the system side, so it's easier for community, but it's a lot of work in partnership with our own IS department as well.
Thank you.
Nicole?
SNAP is still administered through Maxis, right? Maxis is 31 years old.
Exactly.
I'm just going to keep reiterating it, that these systems, the technology that we use to implement these programs for our most vulnerable residents are in their 30s, trying to buy a home, paying off student debt, and it's absurd. It's absurd. And until we fix that, it's going to be really hard to streamline a lot of these things, because even making changes in those systems to accommodate new law take a long time. And one of the barriers and challenges we face in Minnesota is because our rulemaking process is more complex, more challenging. There are excellent philosophical reasons for it, but it means a lot of laws for how we administer these block grants from the federal government are in statute, and it's much harder to change. And then when we do make changes to our systems, we don't always update all the pieces. So in terms of that data sharing, it took us at DHS 4 years to add 2 words to a data privacy provision, because when CCAP moved to a statewide system, prior to that, we allowed counties to share data with the Department of Education about students receiving child care assistance. But then when there was a statewide system implemented, all that data was housed at the state, but statute was never updated. So if MDE wanted data on children receiving CCAP for, outreach on scholarships, for example, or for data tracking on outcomes, they would have to go to each individual county to get that, because they weren't allowed to ask the state who had it all. And it took us 4 years to explain that to the legislature, to add the 2 words and the state and the department, or it was a half dozen words to get them to add that language so that data sharing can happen. And those data sharing hearings are really challenging. And I imagine there are similar challenges that we see between sharing with WIC and SNAP and whatnot. So the systems piece is a huge part of it. And the other piece of that is taking stuff out of statute, or making it simpler within statute. And it's very, very challenging to do that work. So I'm really supportive of the work that you're doing. I guess I had one other question. How many of our residents in Ramsey County are at or below 200% of the federal poverty guidelines? Or what percentage of our residents?
I don't have that information offhand, but I can find it.
Okay. I just think with, 43% of Black Ramsey County residents on SNAP, SNAP is not a safety net program. If half of our population qualifies for it, it's an essential service. And I think that raises broader questions of how do we have a population where so many people are relying on, need to, and deserve to have access to these programs, but wouldn't it be better if people just had enough to begin with? And where do we go, and how does that tie to our work to make sure people are being paid family-sustaining wages for their work? Because this is not what these programs are intended to be, and we don't have the administrative infrastructure to support that level of our population to meet basic needs.
And I would suggest there's another way to look at it on the safety net side, that if half of our population qualifies, it would indicate Ramsey County is becoming a safety net county for the region. Commissioner Ortega.
Echo what everybody
And
said.
then first off, I wanted to thank you for your leadership, because early on, Commissioner Carr asked you to pull together leaders and policymakers and partners early on in the pandemic to really accelerate this work. As we all acknowledged, it was there before, but the pandemic really exacerbated that. And you were one of the early leaders to pull that group together to get things going. So thanks for that.
Well, thank you. You know, these issues are so old. Everything we've said, even before I came to office, being the CEO of a nonprofit, dealing with these same issues in the community. Your work is great. Really good stuff, the data and everything else. And we need to keep focusing in how does Ramsey County implement, operationalize our work better. I mean, that's so key. But when we're talking about the macro picture, we got to do, I mean, we've been going to the legislature, and Nicole just had, from her experience, to change 2 words, 4 years. We really got to get, I think we're at a time now where this impacts everybody. It isn't just African Americans, it isn't just Hispanics, we're looking at everything. But there are a lot of old tapes out there, and we gotta do something beyond. Social media is important, we need to put that up there, but that's about operation. We really need to think outside the box in terms of marketing, because we got a lot of people out there with old tapes that still believe that even though they are food insecure, they point to people like me and say, you need to pull yourself up by your bootstraps. We need to start getting folks that could influence our community and say, this is not a privilege anymore. This is part of what we do as a nation and as a society. So, I mean, I wrote down seniors, WIC versus, we could go down the list, and we got to do the work you're doing. But we're going to be, we got to take a giant step somewhere. And we got to start thinking about what is that, and it is a statewide issue, it's not a county issue. Every county here faces the same thing. And so how do we take that? What is it that we do for that giant step? And maybe it's outside of government. Maybe we prod folks, If we're limited by our rules, if we get the public, those rules don't apply when the public wants to change something.
Well said. Commissioner McGuire?
Wow, so much here. Thank you so much for all of this. There's so many things I want to comment on. I'll try to just keep it succinct here. But just to say with the obvious, of course, that we have food insecurity, and a lot of people that we all know, they want to work in the food shelves, which is great, and they want to do the temporary thing. And of course, we know that it's food insecurity goes to lack of significant wages, it's all the other issues that go along with why people are food insecure. So we have to do both. We have to make sure that they get food when they need it, but that we really deal with the early issues, and I know that our county is working really, really hard on that. I totally agree. This is all not just our county that deals with this. This is systems work that deals with all counties, and I know all of us who are involved in our state association of counties and our national association, we bring these issues to those associations because we can gather all of our allies in those places throughout our state and our country to really work with our legislators and our public officials on these issues because we have to be together on these, because then we can hopefully get statewide reform on this. I appreciate Commissioner Fretham at our District 10 meeting when you fought for modernization of these systems, you know, where we have to elevate these to all of our colleagues. We had to take the show on our road. I know you're taking the show on the road legally or locally. We're taking it on the road to our state associations and our national associations to get our all of our colleagues on board. I mean, a lot of them already are, but we need to really elevate these issues to everyone that we know, so we can obviously take it as a group then to our state and federal policymakers. I just am thinking the Farm Bill has SNAP in it because I think it was so that it would be funded. If it was in Human Services, SNAP wasn't funded. So I think someone way back when said, well, we know there's a lot of people that are voting for that Farm Bill. Let's put the food in the Farm Bill and get it passed. And even when it's in the Farm Bill, we still have to work hard to make sure it stays there. But that did seem to be a little bit of a different thing. But you're like, okay, whatever we can do to make it work, whatever we can do to get that funded. And that was an outside-the-box thinking by someone way
Wait,
back.
could I just interrupt you a minute? The Farm Bill today is a subsidy to the farmers.
Right,
Okay?
right. Which,
So,
no,
I mean,
I
we
am-
need to
right.
stop.
Don't
It's the
disagree.
same language.
Right.
And
I don't disagree with that. I don't disagree with that, but so people knew that people were gonna support it. They said, well, let's put something in it that we need. So, yes, I don't disagree that that's a whole issue we should be looking at. So I just wanna say, thank you so much for all this work. We need to keep bringing it forward to people as you take it on the road, take it to Rotaries, take it to all those groups that like to hear about these issues. You know, Rotary does, you know, they do food shelf work, but they need to hear this whole story. I do have one quick question. You said that a majority of one of the pockets of money went to Little Canada, and I was just, it's the Little Canada. Could you just explain what that was? I don't think it was like to the city or the people there. There's an organization in Little Canada that works on this.
Yeah, the Department of Indian Work, thank you, Commissioner McGuire.
Yeah.
The Department of Indian Works moved the Interfaith Action Food Shelf to Little Canada to serve the indigenous population as well as others. And because of the CBDG grant, they were able to do that to serve Ramsey County in a different way.
Yeah, we're happy it's there. I just wanted to clarify that it's for the bigger audience. When you said it went to Little Canada, I'm like, oh, good, but we know it's to serve the greater population. That's just the location of it.
Yep.
So thank you for that. This is all work in progress that we all need to continue working on. So thank you.
Thank you. Sure,
Thank you, Mr. Chair. You know, all of this is so much, right? It's so much to thank you, Malik, for your work and working with community to get to the source. I want to also highlight, as we're talking about culturally specific food, that we're also thinking culturally appropriate delivery mechanisms. And I think that is where much of the problem lies, right? We have created a system of you have to show up with your hand out and ask and beg and prove that you're hungry enough, when we all know, based on Maslow's hierarchy of need, we all need food. And so thinking about that, which I think why, we've had a lot of conversations with clues specifically around urban agriculture and our cultural communities around urban ag, because then they can do it themselves and they just need access to food. And that's where the culturally appropriate delivery comes in, that's dignified. And so thinking about I know we have it as the next level, but to me, that almost needs to be moved up in some ways, because it is about the delivery that's culturally appropriate to people to be able to eat and think about how we have that access. And I think that, Commissioner Ortega, you're on the right track. And we keep trying to tweak the systems that currently exist, and they suck, quite frankly. And we keep well, maybe if we change these 4 words, we do these things. And really, we need to start over. And I actually think, going back to your comment on the Farm Bill, is we're subsidizing farmers, which, of course, we want farmers to succeed. But as soon as we started making money off of what people need to survive, we lost our ethics in this country. And if we think about the inflation, you know, I went to Aldi, I shop at Aldi. Most of my adult life, I've been food insecure myself. And think about, excuse me, it just makes me so angry that we have to be hungry. You know, I went to Aldi and I got a bag of food that, you know, used to cost $25 and it was $72. And I'm talking like milk, eggs, and cheese and bread, right? Basics. And I think like, okay, we have a problem. And at the same time, give me a second. At the same time, this is public health, so we think about our trash, right? And our recycling, and we're not reducing the amount of food that goes in our waste stream. And so at the same time, when we think about it, you know, Cub Foods, Whole Foods, they're still throwing away as much food, and they've tripled their prices. And so I think we need to go back to the federal regulation to say we need to put a cap on the amount we can increase and how much profit that we're making on food. And that's really the change in the system, because we are profiting on people's starvation. And that is really sick in this country. And so if we think about our federal legislation, somewhere that needs to be put at the table, or partnership with our Attorney General to say this inflation cannot happen this way when it comes to people's needs, and especially basic food security. And then we have to talk about the elephant in the room. We're gonna have a really big uphill battle at our legislature this year because of the fraud at the Feeding Our Children. Right? Mm-hmm. And we can't pretend that that's not real. And that was set us back literally decades of this work. And so we have to think about how do we do this differently when that is what's our barrier to feeding people. And it isn't about one more government program that partners can apply for. We actually need to go away from that, because we're not going to be able to break down that wall for another 50 years. And instead, we need to go back up to the top to think about how do we fundamentally change the way that we feed people. And, you know, absolutely, free lunches for children should be a basic, that, right, without qualification, to have neighborhood gardens and opportunity and food shelves that are not like, here's your bag of food, you get what you get, but actually like free grocery stores that people can choose what they'll use, because there also won't be waste then, because we have waste when we distribute boxes and you get a plant or something that you don't know how to eat or you don't like, right? And to think about those kind of choices. So I love the work that you've done. I've loved the community engagement. I truly believe solutions come from the community, but we fundamentally can no longer just tweak what exists. We gotta create something completely different.
Thank you.
Yeah, thanks.
I gotta go to Commissioner Carter, or Commissioner Ortega, and then Commissioner Carter will come to you.
No, I just, you know, one of the key words that you brought up was shame. You know, people have shame. And that's that goes along with pulling up with your Bruce. I mean, we got to get rid of that. That's what I'm saying. We got to start educating folks at a different, you know, and I think we have enough leadership across the board that we, outside of government, that we need to somehow enlist to start doing this, really almost a massive public education about this, because we're not going to, you know, these battles in the legislature are getting to be silly battles as far as I'm concerned, because we're not on the same wavelength here. They're playing off the old tapes, and we're back and forth, and we're making little micro changes here and there. I mean, my entire career, we haven't moved on this very basic issue at all at different levels. And I just, when I talk to folks, I mean, I'm talking to folks that are connected to farmers. And it's a different generation now of farmers to begin with, and I think they're we need to start educating them. Because we need to enlist their support. We need them.
Yeah, absolutely.
I mean, we're not going to have any changes. We need to get the support of the other side on this issue. And on many issues, but this is an example of one. Anyway, that's all.
Thank you. Commissioner Carter.
yes and yes and yes, and I could have had so much more to say, except for being in this position, hearing all of my colleagues and all of the words that have been said so far. I will just go back to the presentation and thank you again, but also point out how insightful it is to hear from the community that the answers are there, that it is an appropriate time to think innovatively about how we blow up the system, excuse me, but actually work with our community to make those connections. The community has told us that they trust each other, that we trust each other, and that with each other, we don't own the title food insecure, but we know that we can meet our needs. And that is so instructive for the work that has to be done. I am curious about the extent to which we continue to find incompleted applications in our system as the reason people do not actually make that connection to the SNAP resource as we would like. I know that before pandemic, we had good illustration of that being a cause of that disconnection across the state in Ramsey County. And during pandemic, that there have clearly been even greater concerns. And now that we are moving beyond, let's hope, finding that new system that helps us to make certain people aren't, as Commissioner Matas-Castillo said, having to come to us with a handout, but they are finding those resources in the community. I know it's complicated, that application process that we're used to isn't as well done when we connect to churches or nonprofit organizations or farms and gardens. I appreciate the work that has been done in order to offer support through, for example, the market bucks. But it isn't the depth of engagement and support that we need to see in the community. I appreciate hearing everyone saying that. The applications for the RFP that just closed, the number of applications show us the great readiness of a community to lean forward and to do this work. And I hope that we are able to discover those systems together with our legislature and with other county partners and community partners to do that work.
Before I go to Commissioner Reinhardt, there was one question that I heard from Commissioner Kurz. Do we have a sense of how many unfinished or uncompleted applications are out there?
I heard you say we'd ask that later.
Yeah.
Thank you,
So-
Commissioner Carter. I don't have that data right now. I can definitely connect with our interim director of FAS, Ali, and find out if we can get some numbers on that, because I think that would be an important number to have.
Certainly the systems impact is great on that as well.
Then we'll go to Commissioner Reinhardt, and then we'll kind of wrap it up here.
And I just want to lift up something that Commissioner Frethem brought up, because and that is about a living wage. Because if we had a living wage for folks, the food insecurity would not be as profound. I remember when Commissioner Matas-Castillo, you were brand new commissioner, and we had the ERA at the state of Minnesota, and we determined that we needed to put something, some meat on it as far as what difference does it make. And we simply did one check on the income eligibility through our human services area, and said if the women are disproportionately impacted and they make less money, and it was just, you put the dollars and cents to it, and it was very clear that if they were paid a decent minimum wage and it was equal to the male counterparts, that there would be so many, I can't even remember what the number was because it was so long ago now.
8 million a year.
How much?
8 million a year just to Ramsey County.
8 million a year. And that's kind of a basic thing, and I know it goes way beyond what you were bringing us here today. But I didn't want to let it go, because that is really, when we get down to the nitty-gritty, it's about why are people food insecure? Primarily is because they don't have the money or the resources, the land or whatever it is, to get this done. So I wanted to bring that back up because I think it's a really important thing that sometimes gets lost.
Yep. Thank you. Well, you guys have done an amazing job with your presentation and the work. I think you're hearing from us, the engagement here. Absolutely, from the governing board here, encouraging to continue to do better on what we can control, right? Immediate impact. Kind of this longer term or bigger complex issue about how we can be helpful in making those bigger changes, whether at the state or federal level. But then, I think you've heard from a number of us, really, it's, we got to do better than just chewing around the edges here. We've got to find ways to take some leaps here. And you've got the support of this board as you're working with your work groups or partners in the community, to push for those leaps here in this area. And we'll be looking for further updates. Malik, Sarah, Carissa, Kathy, Ryan, I'll give each of you an opportunity for a sentence or two here on last words if you want it. Who wants it? All of you. Malik, I'll start with you.
Thank you for your time today and your overwhelming support. And I really think that you all said it, that community is really knowledgeable. They have that deep wisdom. They know what they want. They know what they need. They have the answers. They have the solution. And they're just looking for folks with power and authority to make the move.
Great. Thanks. And thanks for being a part of this, Sarah.
Thank you all for your time, and I look forward to continuing to work on this issue with Carissa, who is very passionate and very dedicated to it.
That comes out pretty well. Carissa.
I just want to thank you. I mean, a lot of the information we heard from community about strengthening the safety net system and increased access to benefits, this isn't new stuff. People are reliant on not only SNAP and WIC, but they also are reliant on food shelves, and there's just not enough support for them right now. And so I do appreciate this. None of this information was brand new to me that we heard from community. However, it's shifted so much with COVID that I think it's great to have a direction now. I think because the food world is so big, you could do so many things to try to change it. So this feels like we have a package, a direction to go in and involve more community. So I thank you for your support. I do want to let you know I'll probably be coming to you with some grant proposals and such for your blessing to receive funding and whatever we can do to support our safety net system and other partners. So thank you so much.
Thank you, and thanks for all you do. Kathy?
Thanks, Chair McDonough. I appreciate it. Appreciate the team's hard work. And to Malik and to Taki, who's here with us today from Imagine Delivers, appreciate you being here and appreciate the partnership here with community and all the other staff who are working on this within our system. You could see within the presentation that a lot of work has been done to coordinate and to connect multiple departments, multiple service teams, which is the point of having a food security coordinator working across our system, and it's working, so we appreciate that. And I appreciate, Commissioner Ortega, you bringing up that this has to be bold. This is hidden, and there's so much shame around food, and we don't see it, and it's not the same thing as seeing somebody on the street where you can see it and it's affecting your infrastructure or affecting how you go about your day. This is hidden, and unless we do something that is bold and that focuses energy in this and changing the system, it is going to be something that this group of people in 20 years is going to be having the same conversation. So I appreciate the passion that was brought here today and appreciate the support as we figure out ways to do these bold things moving forward. Thank you.
Thank you. Right?
Thanks, Mr. Chair. Just two final thoughts. Thanks to the team also for your great work here today, but all the way through COVID. As has been mentioned, we've had a group working on this through some times where it required it, and to build out of that is really an important part of our story. The piece around the min benefits conversation, I'm going to keep saying this at every board meeting now for the rest of the year and into next year. I mean, I'm a little worried that the narrative becomes like we shouldn't have had a new system that makes it easier to apply. No, the new system that makes it easier to apply is great. what are we going to do, though, about the idea that we made a new system where it takes less than, I mean, I could have applied during the workshop. I went on today, and they even have a banner across the top now that says, hey, you may experience long wait times working with counties or tribal nations. Okay, so the question I have is, how do we go get rid of the banner at the top this legislative session in partnership with everybody, not tear down the idea that they made a better application? And there's I see a lot of opportunity there that ties into this. I'm going to end on just a broader positive note in the context of really tough stuff. In September, there was a big body of research published. The New York Times did a series of things that I'll send around the podcast and the articles and the source data. It's good to see. It goes to state level and national. But childhood poverty is down 59% in the United States since 1990. It's down more than that since 1980. And it's down double that for the deepest impoverished households. And that's happened basically in a similar proportion across race. Disparities have not decreased, but they have not increased as a part of that reduction. And it's fascinating information to look at in the broader context, but it gets to the idea that broad changes to the social safety net have had significant impacts when they happen. And they're always having to be bold, and they don't happen in a linear way. They happen at once. And the biggest one was the expansion recently of the childhood tax credit, had the most significant impact of anything we've seen. Cash in people's pockets. There's a lesson to be learned there. I don't have a direct correlation or connection, but it's like there are lessons to be learned in that. And so I'll make sure to just share that around, because there are 9 factors that they look at as potentially why that has occurred in state by state. Teen pregnancy, crime rates, all sorts of stuff. It's just very helpful as we keep going and remind ourselves food is one part of a bigger way in which families and communities care for one another. And I believe this team and this organization's up to the task.
Thank you. All right, my hope for everybody that they can share a meal with a friend, a loved one, somebody who cares about them here later in the week. So thank you. Well done. We're adjourned.